It's just now the start time for this webinar, and we'll continue to see participants and audience filtering in. Okay, it's 1 minute after, and I think it's appropriate to start now. Welcome, everybody. I am extremely honored and pleased to be a participant in this webinar titled SI Joint Dysfunction Related to Pregnancy. We have a really impressive and incredible group of speakers today, and I'm looking forward to learning something new. As much as I've spent time learning about and researching the SI joint, I think this is a topic that is incredibly important and one that's very much a part of everybody's lives as it is so prevalent within the population. I would like to start with just a few slides and as an introduction, and then I will introduce our speakers. So I'd like to start with simply making everyone aware of the size of the problem. According to the United Nations, globally, there are two. I'm sorry, I think, Martin, if you could mute, please. Whoops. So I apologize. So again, according to the United Nations, globally, there are 213 million pregnancies every year. 385,000 babies are born each day, with 140 million each year. This is a massive situation, a great situation across the world with so many new babies delivered on an annual basis. But the pregnancy also is something that's been very under-recognized. Up to half of pregnant women will have pelvic girdle pain. A large proportion of back pain in pregnant women is related to pelvic girdle pain. And pelvic ring instability in pregnant women ranges from 1 in 569 to 1 in 30,000. So potentially there are 7 to 375,000 women with some form of pelvic instability related to pregnancy on an annual basis. This is incredibly large and an extremely important problem that's been very under-recognized over our history. So today I'm really extremely excited to introduce to you our speakers. And I will keep my slides up. Our first speaker will be someone who does not really require any introduction. Daisuke Kurosawa is our president of SIMEG. He is our driving force and has been involved in SI joint treatment and SI joint education since 2009, when he first learned about SI joint arthrodesis under Dr. Murakami, and has been a part of SIMEG for many years now, and is now our current president. And arguably, as president of SIMEG, he is the greatest driving force within SI joint treatment and education and recognition of the problem of the SI joint. We're also extremely honored to have him presenting together with Dr. Hirokazu Tanaka, who will be presenting with Dr. Kurosawa. And it's a great honor to have them both together presenting on pelvic ring instability syndrome in young women patients. Will then be followed by the next presentation will be sacroiliac joint, pubic, and other lumbopelvic region pain during the perinatal period. I'm thrilled to have Dr. Saori Morino, who is a physical therapist, who has dedicated her life and research to the care of patients with perinatal problems in women. Her experience is tremendous, with a BS in health sciences from Kobe University in 2013, and an MSc in human health sciences from Kyoto University in 2015. And then finally, a PhD in engineering from Keio University in 2018. And she is currently an associate professor at the Department of Rehabilitation Science at the School of Medicine at Osaka Metropolitan University. A fantastic background and a tremendous amount of experience. We will then have a presentation on how to identify a patient with postpartum sacroiliac joint dysfunction. Are they different? By Dr. Bent Sutterson. He is an orthopedic surgeon and a spine and pelvic consultant with an MD and PhD. And his PhD research and thesis was on biomechanics of the SI joint. He's a pioneer in surgical treatment of the SI joint in Sweden since 1989. And he's been working on both open techniques and minimally invasive techniques in the SI joint surgery. And he's the co-founder of the IMIA study. Welcome, Dr. Sturluson. Again, tremendous experience and history with the SI joint. And finally, last but certainly not least, Dr. John Stark will be speaking on sacroiliac joint fusion surgery in women of childbearing years, the orthopedic considerations which may affect delivery. Dr. Stark is a graduate of the University of Minnesota Medical School and has been in practice since 1981 in orthopedic surgery, including extremity and limb salvage and trauma. And he has had 8 years of experience at the University of Minnesota as an assistant professor as well. He has had many, many years of experience with the SI joint since 1993. And he is also the inventor of the Diana and Nadia SI joint fusion methods. So welcome, Dr. Stark. With that, I will